The pandemic emphasised the need for reliable and fast PCR tests in detecting infectious diseases, especially for clinically vulnerable patients. bioMerieux's Spotfire solution provides rapid and precise testing for multiple respiratory pathogens, reducing diagnostic uncertainty and enabling real-time patient care customisation. We went to Sheffield to find out more.
There are some patients at Sheffield Children's Hospital facing critical health conditions such as cancer, which require immediate treatment.
He's due chemotherapy later, so if you can swab him now,
then
let me know the result.
And respiratory conditions can affect treatments like chemotherapy. Waiting for lab results can cause delays, so the hospital's been trialling a new point of care test, which delivers results in a matter of minutes.
My work is primarily looking after children undergoing treatment for leukemia, and what it means is we can make a much more accurate assessment of the risk of continuing chemotherapy versus pausing chemotherapy. If we never gave chemotherapy to a child with a runny nose or a cough, it would take us forever to get through their chemotherapy, and we know that leukemia is more likely to be cured if you can continue to keep up the tempo of treatment. So knowing if it's something serious and whether we need to interrupt treatment or not is really important.
Spotfire has been developed by diagnostics test company bioMerieux. Today, I'm being shown how it works.
So we're just going to do a quick respiratory swab on Becky.
Becky, thanks for playing our patient.
That's okay.
So then we put this in solution and then we're going to run it on the machine.
Okay, cool. What happens next?
So now we have to put the solution in one of these tubes to get it tested appropriately.
And traditionally, all of this testing would be carried out in the lab?
Yes, it would, yes. So once we've done that, we need to get the cartridge out of this tube and register it on the system.
So this makes sure that there's complete traceability?
Absolutely.
After the sample's been prepared,
we take him out and then the cartridge goes into the machine to be run.
And so it's a very clear step-by-step process?
Yes, very much so. You have to follow every step, otherwise the machine will tell you you've done something wrong.
This rapid diagnostic tool tests for 15 causes of respiratory infection, delivering a result within 15 minutes, which helps to inform clinical decision-making.
What's different in this case is this machine tests for a whole range of viruses that may not be particularly dangerous to otherwise healthy children, but can be very dangerous to children with compromised immune systems like cancer patients.
It also frees up laboratory staff to focus on the tests that require complex lab skills.
The lab tests require skilled staff. They require a fairly large footprint of lab space, and they also require the samples to be transported to our lab. So that takes time, and a result can take 1 to 2 days on average to get a result back to the patient. Whereas by providing the test next to the patient, and because it's much more condensed and can provide the results in a much shorter period of time, that can really benefit the patient for a number of reasons.
That innovation to bring the test result quicker, I think is the key element to delivering improved healthcare outcomes for the area that we're involved with. If you can do a timely diagnostic right close to the patient, then you can make better clinical decisions, and that will not only improve patient outcomes, but in lots of cases actually save the NHS money. We can discharge patients earlier, we can put them on the right treatments, and that's got to be better news for everyone.
Including other patients who may be compromised by contracting a respiratory condition.
What we really want to avoid is a situation where a child is in a room with other patients and then turns out to have a virus that's potentially dangerous to other children. It's allowed us to know exactly what's going on and make prompt decisions, which results in very efficient patient care.
To be able to have that really clear, this virus is present, this virus is present, this virus isn't present, really aids the clinician to be able to make the right treatments. And it's as simple as that. That's what the results tell you.